Chronic pain, it's often debilitating, mysterious, and unfortunately, very misunderstood. For patients, it's life-altering. For doctors, it's one of the most challenging conditions to treat effectively. What if you could decode the complexity of chronic pain and confidently change that in the lives of your patients? Dr. Norman Hoffman has pretty much mastered this challenge over the past decade. I'm Dr. Matt Antonucci of the Carrick Institute, and today we're diving deep into groundbreaking approaches created by Dr. Hoffman to master chronic overlapping pain conditions. So hello, Dr. Hoffman.
Hello, Matt. How are you doing?
Yeah, I'm good. I want to ask you a few questions today, and I'm sure that many doctors have these questions in mind, all about the chronic overlapping pain educational track that we've built for the Carrick Institute. Are you ready for that? You game for it?
I'm game. Let's go.
Okay, here we go. First question, what inspired you to focus on chronic overlapping pain conditions, and why is this topic so critical for healthcare providers today?
Well, the honest answer is my family. I have a lot of family members that have got things that fall into the chronic overlapping pain category. And when I was doing my master's track through the Carrick Institute and finishing up my master's degree in clinical neurosciences, you got to pick a topic. You got to pick something that you're going to do that kind of defines your entire project and your capstone. And it ended up that there was so much new research in the fibromyalgia world since I was in school back in the 90s. I graduated in 94. And I didn't realize how much there had been in the last 10, 15 years, but even the last 5 years has just absolutely exploded. And so I dove deep into the fibromyalgia research and ended up finding this whole track on chronic overlapping pain syndrome, which you used to call central sensitization. So, that's still the thing, but central sensitization syndrome was the kind of the nomenclature for it. But the NIH decided to create a whole new category of pain for chronic overlapping pain conditions, and then just throw a bunch of money at it. And so all of this research has been exploding since 2011, 2014.
That's amazing. So correct me if I'm wrong. There's a difference between pain when you're injured and pain when you're not injured, correct?
Oh, 100%. We even categorize it differently. So there's nociceptive pain, which we're all familiar with. And then there's nociplastic pain, which is the changes that occur in the nervous system, secondary to having chronic pain that exists for time and time and time. The central nervous system becomes sensitized. That's the central sensitization, which is still a concept that exists. And then it turns the volume up on the pain, and to the point where now you no longer need a pain trigger to create pain on an ongoing daily basis.
So that's important. So as a practitioner of physical medicine, when a patient walks into your office and says, "Doc, I hurt," you really need to triage whether there's tissue damage or in pain, or no tissue damage and pain. And the treatment for those would probably be remarkably different, right?
Well, yeah, you absolutely have to treat nociplastic pain differently than you do nociceptive pain. And it really does matter. It matters that you come down, that you do a proper history, you do a proper exam, you know what you're looking for. And to be honest, most doctors are not well trained in what to do with chronic pain. And they're going to treat chronic pain and acute pain as if they were the same thing when they walk in the office. And that's no disrespect. That's just the education that we've had to this point. That's what's out there. There really is no difference in the treatment protocols for chronic or acute pain, and there should be.
Yeah. So if you're treating a chronic pain patient like an acute pain patient, is it fair to say that your patient will plateau and will both hit a wall and nobody's going to be happy?
Well, yeah, most doctors find chronic pain patients frustrating, especially fibromyalgia patients. There's been study after study after study, plus you just talk to your colleagues, and they don't want them in their office because they frustrate them. They're a little bit more emotional. They're a little bit harder to deal with. And every time you treat one thing, another pain pops up someplace else, and they just get frustrated. And so the ineffectiveness of the treatment program becomes sort of self-limiting for both the doctor and the patient. The patient's frustrated, the doctor's frustrated. Then it just goes around in a circle.
Yeah, and I've seen it also often where they say this patient is frustrating What they
Yeah.
really should be saying is, I'm frustrated with this patient because I don't understand them, right?
Yeah. Yeah. They don't know how to treat the patient differently than they treat somebody who had, a shoulder pain or something like that.
So your course covers conditions like fibromyalgia, migraines, TMJ. Those are all typically labeled as hard to treat. What makes your approach unique and effective for these types of patients that, a lot of times people struggle with?
Well, we're going to combine what we have been combining so far, but we're combining the ability to look at the relevant anatomy for chronic pain and the effective treatment programs that exist for chronic pain and central sensitization of the nervous system with the manual therapies that are so near and dear to most of our hearts, so that you can get in there and do something different but good for the patient. And so if you can treat all of the pain generators that are going on, and at the same time have ways to deal with the kinesiophobia, the fear of movement that the patient has, so they'll avoid activities. Some of the psychological aspects that go with that, some of the changes in the cord, some of the changes in the brainstem, and the same stuff that works for traumatic brain injury and for concussions and for movement disorders does not work in the chronic pain world. And you have to have a unique approach that goes after, all of that aspect. So we combine the chronic pain side of things, the central sensitization, that changing of the plasticity of all of the cord and brainstem structures with the manual therapies that are able to change things on a physical medicine sort of level. But we're also looking at neuromodulation techniques as well that go into there. So lots of cool stuff going on.
Very cool. That makes so much sense. Now, there's a word you threw out there when you were giving your explanation. You said we're going to look at the anatomy. When you say the anatomy, you're not just looking at anatomy of the body. You're also talking about neuroanatomy, right? There's one of the key components of, I think, your program is not just treating the body, but also treating the brain. Is that accurate?
Absolutely. Yeah, no, we're not talking about, we do have to go into, if you're going to, because, module 4, we look at low back pain. So we're going to look at all of the pain generating structures with that and go through all of that anatomy. But no, you have to know really detailed stuff about the cord, the dorsal root ganglia, about the locus ceruleus and the rostroventral medulla, and, all of these sort of things that go on with the way the pain is modulated from the top down and the bottom up really helps a person to be able to deal with these things on a different wavelength than just simply saying, okay, well, I'm going to, manipulate this, or I'm going to do muscle therapy for that, or whatever.
Yeah. So those are some big words there. But one of the things that I love about the courses that you teach is that you have this amazing ability to take complex concepts, like those brainstem areas, and make them really simple to understand and apply. So I'm sure you're going to continue to do that in this program. And I think that's something everybody should look forward to. So I guess that kind of dovetails me into this next topic here, or this next question that I had in my mind. There are all types of healthcare providers out there, some that have really great understanding of things like those structures you were talking about in the brain, and some that I haven't heard that word since I started neuroanatomy 22 years ago. So I guess the question that I'm wondering, and I'm sure people that are watching this I wonder as well too, is what type of healthcare providers can benefit most from this course, and what skills will they actually walk away from this course with that'll help them transform their practice or the way that they treat patients?
Yeah, well, I think to answer your first question, like what type of practitioner, any kind of practitioner, I think would benefit from this. If you were strictly a medicine and nutrition based practitioner, you would benefit from this. If you are a chiropractor, hands-on in the trenches kind of practitioner, you'll benefit from this. If you're a physiotherapist, a naturopath, if you're an acupuncturist, if you're TCM, if it doesn't really matter. If we're really trying to create, because the whole program as a whole is 100 hours. And if you were to complete that 100 hours of the course, you would become an expert. I promise you will be an expert in understanding chronic pain and all of its different forms. Talk about 10 different conditions falling under the chronic overlapping pain condition umbrella, which is sort of tip to tail. You're dealing with head pain, but you're also dealing with pelvic pain and you're dealing with abdominal pain and all of these sorts of things. So understanding that is the core outcome of the course. So that by the time you're done, you are a worldwide expert in understanding this stuff. Especially, you might want to take it or you might want to rewatch it a couple of times if you really want to get to the point where you could teach it to somebody else. But you by the time you're done, you'll understand it in a way that just really makes you kind of feel warm and fuzzy inside. And then that understanding combined with the applications that we put in allows a person to have that confidence to go in with their patient and say, I understand this condition and I am the right person to deal with this for you. And that's a really nice feeling, because most doctors go into a chronic pain situation and go, oh boy, I hope it's.
Yeah, exactly. And, so I guess what I'm hearing is if you work with patients, they'll benefit from this.
Yeah.
And that includes individuals that I'm assuming that do like joint injections and do rhizotomies and things like that. I mean, is this a complement to what they do? I mean, you're not teaching invasive techniques, right? You're not.
No, I'm not.
Yeah. You're not prescribing drugs, for example.
No. Okay. No, I don't do that. I don't have the license for that. And I don't go down into that particular rabbit hole. We cover very, superficial versions of that in certain aspects, but no, the underlying neurophysiology and that sort of thing, we cover it at I'm going to say like 2 or 3 levels. So for the people that this is their first introduction, they've never taken a neuro course, they're complete novices to the whole thing. They will get, a lot out of this. And as you recall from people that have been at previous classes for this, even if they don't have they're not even doctors and they're like, I'm getting something out of this class. So we have the ability to help people understand these fairly complicated concepts at a level that will apply to anybody at whatever level. And then we're also, for the people that need it, want it, and can handle it, we're also covering it at a higher level. So the people that, that's too much, that's okay. They're going to get it. They're just going to get it at that level. And then we're going to cover it at multiple levels, which is why I'm saying, like, as you know more, if you took the class, you repeated the class, you watched the recordings again, you'd get more out of it, because I do teach it at multiple different sort of stratospheres, if you will. The novice and the expert are both going to get something out of this that they can take home and hang their hat on.
I think what Dr. Hoffman's talking about is the person who was doing our video capturing, basically our video producer, was filming Dr. Hoffman's course. And after the course, he's like, I feel like I can help somebody. He started, coming around to me. He's like, can I feel some of your soft tissue? And he's like, oh yeah, do you feel you're fixated here? And, do you have any shoulder pain? I'm like, yeah, my left shoulder. So our video person was taking this information, coming home with it, and understanding how to apply it to, I can't call it patients because he's a video person. So I think that's what he's talking about, is no matter how I guess new you are to healthcare and education, or how advanced you are in healthcare education, you can get something out of this.
Absolutely.
So let's wrap this up with probably something that's people really appreciate. Can you share a single success story or case where these strategies made a life-changing difference in a person's path or their interaction with chronic pain?
I mean, good gravy. There's probably 100 stories. It's that's it's a tough one to isolate one particular one down. As I think about, if I think about something in the fibromyalgia world, probably the most common thing that I hear that is just sort of like, life-changing is the ability for the patient to say to me, I was able to unload my car with the groceries and carry them up the stairs, and I didn't pay for it for the next 3 days. Like, that's a little thing, but for that person, that's life-changing, right? Like that kind of ability. And the tears in the eyes when they can do something, I cleaned my house, and I haven't been able to do that for 8 years. Those kind of things are the things that make it really kind of worthwhile to do this, and really give you the confidence to go forward and to be able to help other people with it. And the next person comes along and you say, what, I'm pretty confident we're going to get you, a better quality of life than you've had thus far.
Yeah, there's one thing to change the numbers on the pain scales. It's a whole different thing to give somebody their life back, right?
Yeah, absolutely. You know,
Yeah,
we use the scales and the questionnaires and they get better and we see those improvements. But I mean, it's the real heart to heart connections that you have with the real people that just, you can't beat that.
exactly. Well, Dr. Hoffman, thank you so much. As always, it's a pleasure speaking with you. I hope this answered a lot of questions that people had about your course. And hopefully people will be interested in learning more. I can tell you just from some of the courses I've taken with you and some things I learned about this class, and it's a beneficial one. And in myself personally, obviously, I'm a treating provider as well too. I'm one of those people that says chronic pain, stay away. So I'll be certainly sitting in the course with you at some point in time so that I can learn all these different things so I can help people better. So like we said, everybody can benefit from this course. And we're so glad you put it together for us.
Thank you for allowing me the opportunity to share it with people. I think that's just the best you can do is, you take something that instead of has helping hundreds of people, you help thousands of people by training the practitioners.
Absolutely. And if you have any questions in this program, you can always reach out to the Carrick Institute. You can come to our webpage. You can comment on our social media. You can send us messages. We'll get your questions answered and we'll get them back to you as soon as we can. Until we speak to you next time, take care.